in that I'm discussing topic importance to USMLE step 2 CK and a step 3, right? Let me start this with the Achalasia. So I would like to define you what is Achalasia. Achalasia is a primary esophageal motility disorder characterized by failure of hypertensive lower esophageal sphincter to relax and absence of esophageal peristalsis. So what happens, the LES is just between connection between the esophagus and the stomach, right? So this is very constricted, right? So what happens when it is severely constricted? So there is no passage of the food from the esophagus to stomach. Okay, so when there is no passage of the food from the stomach, from esophagus to stomach, the patient can regurgitate. Remember, this is very important point, and they have a difficulty in swallowing solid foods and later liquid foods. Sometimes what happens, patient may have can pass easily the solid the liquid one compared to solid, and vice versa. Okay, pathology, remember. Okay, there is a pressure, there is a balance between excitatory and inhibitory effects. Excitatory like acetylcholine and substance P, and inhibitory like nitric oxide and vasoactive intestinal peptides. When there is an imbalance, that results in achalasia. Remember, when there is an imbalance, that results in achalasia. Okay, so how USMLE presents to you is they give the history of a nearly 25 to 60 years old, like a 30 years old female. Usually they give female, but the ratio is actually the common, right? Sometimes they can give to male also. So remember age and the ratio. So what is the most common symptom is the dysphagia. Remember, they give the history of dysphagia. They should give the history of dysphagia rather than chest pain, heartburn, or a weight loss. Weight loss is common in achalasia next to cancer. Okay, the dysphagia, remember about the dysphagia, most important symptom. Okay, test. What do? The barium study is initially good. Initially we need to do the barium studies, right? This is very important. Which of the following is the next best step? The barium studies are the best step. If they give the clear history of dysphagia for related to achalasia, then do barium studies. Okay, the X-ray shows bird beak appearance. The best test is a manometry. So the definitive diagnosis is the manometry, right? So motility studies are the best. So when do you do esophagogastroduodenoscopy? Sometimes what they give in step 3, they give the history of achalasia, and they give some signs and symptoms. That is very important, you need to note. Okay, can you tell me what are those? Guess, guys. Okay, let me tell you. Remember, these are very important. If achalasia started after the age of 60 years, remember, 60 years, and the duration is more than 6 months of the symptoms, and there's a history of weight loss, and there is a blood passing the stools. Okay, if there's a blood passing the stools, so then you need to remember these are the very important signs and symptoms that you need to go with the EGD, that is esophagogastroduodenoscopy. Okay, so what are those? Weight loss, age more than 60 years, blood in the stool, and the duration of symptoms more than 6 months. Okay, let's plan with the treatment. Initially you can give pneumatic dilation. So pneumatic dilation is initially it is given, but if the patient is not willing of pneumatic dilation, then you can give botulinum injection. Okay, botulinum injection, how it helps is it relaxes by affecting the release of acetylcholine. So this is very important. The calcium channel blockers and nitrates are used to decrease the ileus pressure. So remember, sometimes in USMLE they give the calcium channel blocker or nitrates as an option. So remember about this. It can also be used to decrease the ileus pressure. Okay, thank you so much for watching my video. Please do subscribe, rate and comment.